Hello and good morning, everyone. Thank you for joining us this morning at the orientation webinar for Western University College of Optometry Clerkship Preceptors. I'm Dr. Aida Chung, and I'm the instructor of record for the Clerkship Program. Here with me this morning is also Mrs. Kelly Visconti, who's our manager of the Clinical Education Programs, and web administrative assistant for these programs, who is Ms. Crystal Gali. So I just want to start off by saying thank you to all our clerkship preceptors for really supporting the clinical education that we have here at Western University College of Optometry. Your role in these programs are so instrumental in our success for educating our students, so I really appreciate that. So a big thank you. As you know, our clerkship program is actually part of our patient care services track here at Western University College of Optometry. And the Clerkship Program is focused on enhancing the clinical skills of our students. So prior to the Clerkship Program, our students have had hands-on experiences with vision screenings, which we conduct mainly at local schools. And now we have students in the Clerkship Program, doctors like you, who have opened your private practices, for our students to really get a lot of this real-life, hands-on clinical experiences that we want for our students. And what we have, of course, is also practices that emphasizes different aspects of optometry. So our students will get exposure to a primary care setting, as well as rehabilitation services, including vision therapy, neuro-optometric rehabilitation, and low vision rehabilitation. For this Clerkship Program, our emphasis on the students' involvement with patient care is to perform a variety of duties, but our emphasis here is really hands-on. So they can be serving as technicians for a lot of your pre-testing or para-optometric testing in your offices. Our students also can be either first years or second year students. So depending on where they are in their education training, they can serve to do those techniques that we've already trained them in. We really want students to receive as much hands-on, direct patient interactions as possible and when appropriate for your practice. And if there are situations where our students can assist in the administrative functions of your office, we allow that, but we would like to keep that as a minimum. Also, if the chance arises in your practice and students are able to observe what you are doing, so there may be skills that students have not been taught how to do, we encourage that to be acceptable for students to observe. What I'd like to show you here are the skills that are learned by January of the first year student. So when the student is in your office, if you happen to have a first year student in the spring semester, these are the skills that they've been learned and also tested on. So you see here we have a limited case history, we have a lot of your pre-testing, which includes visual acuity testing, blood pressure, extraocular motility, eye alignment and cover tests, accommodation, and as well as convergence testing, confrontation fields, Hirschberg pupil testing, and also some of your perhaps supplementary testing, including Amsler grid or 4-dot, random dot stereo test, and color vision. They also know how to measure PD. So those are the skills learned by January of the first year. For those of you who have a second year students in your practices, these are the skills learned by August of the second year. And you see here that these skills students have already passed a proficiency examination. So we have rhinoscopy, we have your refraction, including subjective. They know how to do binocular balancing, and as well as some of the binocular testing, horizontal and vertical phoria, emergencies, binocular fused cross-seal, accommodative testing, including negative and positive relative accommodation. There's also a series of optical related activities that students have been tested on, including lensometry, determining the optical center and induced prism calculations, bifocal segment measurements, identification of frame and lens materials, frame alignment and adjustments, using the pupillometer, and also looking at measurements of lens warpage, slab off, base curve, also measurements of lens thickness. So you see What you see here is a list of skills that are learned by the August of the second year student. Now, what I want to share with you are some skills that we've taught students in laboratory, but these skills have not been fully tested with a proficiency examination, meaning that these are some of the skills that you can have our students assist with, but know that you may have to have a little bit more oversight with these students if you choose to have them participate in these, such as comprehensive case history, non-contact tonometry. Please note that by November of the second year, our students would have learned the Goman tonometry and also Tonopen XL tonometry. They know the proper procedure for eye drop installation, and they know a slit lamp basic technique. And by November of the second year, they would have learned the faux slit lamp examination. They know how to perform additional testing like accommodative facility, modified Thornton, the Bruckner test, keystone visual skills, some of the vision therapy techniques, lifesaver cards. They know how to do Maddox rod, heart chart, rock string, and even for the rehabilitative sites, sighted guide techniques as well. So again, this is a list of skills taught in lab by August of the second year. I'd like to share with you a list of conditions that our students should have rudimentary knowledge and understanding of by February of the first year. So what you see here are refractive errors like myopia, hyperopia, astigmatism, presbyopia, some of the binocular problems with strabismus. They know how to quantify the type of strabismus that they have. Amblyopia, conditions of convergence and deficiency, convergence excess, as well as divergence excess. You'll have some rudimentary knowledge and understanding of certainly patients with high blood pressure, anisocoria, complaints of headaches, as well as basic visual impairments, including vision requirements for certain job related to job occupations. Some understanding about learning-related vision problems and what to ask in history, as well as how to treat them, mild traumatic brain injury, and visual field loss. So this is a list of conditions that students should be somewhat versed in by February of the first year. Okay, now I'd like to move on to our grading for the students, which we ask preceptors to do. There's a little bit, for those of you who have been in our Clerkship Program for the past year or more, there have been a few modifications and hopefully simplification in terms of the grading that we ask you to provide to evaluate our student clinical performance. So what I have here are the 5 categories of areas that we will ask you to assess our students in, and these are the clinical skills, the knowledge base, the communication skills, professionalism, and the attitude towards learning. And so when you go into MetaTrack to do this grading for us, we will have the description of each of these areas that we are asking you to assess. And the way we will ask you to assess is by using the following grading scale. So you will have 4 choices in terms of assessing the student's clinical performance. And we have them defined as advanced, competent, needs improvement, and unsatisfactory. And the way that you would determine which of the grading to choose is by observed behavior during our students' performance in your practice and how often you observe the behavior. So we define advanced as observing a certain behavior at least 90% of the time. Competent as observing a behavior 80 to 90% of the time. Needs improvement is a behavior that's observed between 70 to 80% of the time, and unsatisfactory is a behavior that's observed less than 70% of the time, or the performance of the student is not in the best interest of the patient. So you see here that we are setting a bar of about 80% performance to be considered competent for the skills that we mentioned. We'll be asking you to submit student evaluations through MetaTrack, and it will occur at the end of each 8-week rotation. We'll be asking you to provide general student performance comments. However, if there are areas where our students need improvement or unsatisfactory, we'll be asking you to provide comments in detail in terms of what weaknesses were observed and what areas students need to work on. Now, just be aware that we are not asking you as preceptors to issue final grades. That would be done by the course instructor by looking at the comments and your assessment of each of the areas for the student performance. And the grades that our students will be receiving, as determined by the course instructor, is honors, pass, remedial, no pass, and incomplete. Okay, now I'd like to turn over the mic to Kelly Visconti, who's going to go over some of the policy and procedures related to the Clerkship Program. And at the end, we will have time for you to ask any questions that you may have.
Thank you, Dr. Chung. Good morning, everyone. I'm here actually to go over the important policies that we have for our students attending the clerkship site. And the main one is attendance. And the attendance for the students is mandatory at all clinical rotations, and that includes clerkship. If a student would like to request time off, they must do that through the Associate Dean of Academic Affairs, who at this time is Dr. Kurtz. And once that is determined, if it's an excused absence, then I am made aware and I will make you aware if a student is not going to be in attendance at your site. What determines an excused absence or unexcused absence is such as an emergency absence. If it's an emergency, in true emergencies, we usually do not find out at the time that they're going to be late. So if they are requesting an emergency absence, likely we will find out after the fact, so they may not show up. You may call me and say, your student didn't show up, and that is perfectly within your right to do. I will always let the preceptor know as soon as I am made aware of any type of emergency. And the college defines emergency as what is written on the screen: trauma, death, childbirth, a sudden illness, and all of those are considered excused absences. And we do expect the students to notify us, and as I said, it sometimes does not happen prior to them attending your site. And I may be made aware after the fact, so if they are at your site at 1 o'clock, we're supposed to be there at 1 in the afternoon, I may not be made aware until 3 or 4, and then I will, of course, call and let you know as soon as I am made aware. The other type of absence is a swap assignment, which we do not allow swapping for any external clinics. The only swapping are allowed for our clinical rotations on campus. So students should not swap out another student in their place for their clerkship assignment. So you will always see the same student on the day of their clerkship assignment. An unexcused absence is also something that students do know about. They know that an unexcused absence is usually defined by something that's personal: vacation, family time, wedding, or a baby shower. That will not likely be excused by the college. So in that event, if they know they're not going to receive an excused absence from the Associate Dean of Academic Affairs, they will likely come to you and ask you for a makeup, which is a form that we have that if you agree to have them attend your site at a different time on a different day so that they can take this day off, that is completely up to you. Unexcused absences, though, are considered unprofessional behavior. So if they do not request this with a makeup form in advance, that is something that you should let us know if they do not show up. And likely if they don't show up and I don't know about it, a call to me, the manager of clinical educations, is in order. Tardiness is something that is also considered unprofessional, and it's lack of consideration for the preceptor. And we would like you to keep an eye on this and notate this in Metatrek on the evaluation under professionalism. They should be on time, ready to work, ready to see patients. at their assigned time at your office on their specific day. The same goes for preceptor absence. We know that there are times you may also fall ill or have times that you need to be off as well. And in that case, we just ask for the same professional consideration. Either alert the student. It would be great if you could let me know in advance, and then I will tell the student. And then maybe we could have schedule a makeup opportunity for a time that is mutually convenient. Of course, if a makeup opportunity is not possible at your site for another week on a different day, there are also alternative vision screenings and different things that we can do on campus as well for the student to make up the time. But we just ask for the same with regard to the preceptor's absence as we ask if the student is going to be absent. Okay, so now we have time for question and answers. And we also have some frequently asked questions and some answers on that. Any questions so far? No?
No questions. Wait, let's let them know one more time to type it in the Q&A box in the corner of your screen.
Okay, so if you do have any questions at this time, you can type it in at the corner of your screen, and we will answer them. Otherwise, we can go over the frequently asked questions, and we have answers on the next slide. So one of the questions we're asked a lot is, what happens if I notice a problem with the student's technical skills for their specific level? If you notice a problem, frequently it would be good to send an email to the manager of clinical education programs. I will then alert the instructor of record, Dr. Chung, and likely a phone call will be made so that we can discuss what the specific issues are with the student. What if my student doesn't show up on their designated day? If the student doesn't show up on their designated day and you have not heard from me by either a phone call or an email, it's likely that I don't know. So a phone call to the manager of the manager of clinical education programs, me, would be in line. That would probably be the best course of action if they don't show up. What is a makeup form that this student wants me to sign? Sometimes we have students that will just put a makeup form in front of a preceptor without saying anything, and what the makeup form is was what I described in the attendance policy. Is if they are wanting to take time off for a personal reason, they may ask you to have sign their makeup form and try to schedule a time that's mutually convenient with you, so that they can make up the time that they would like to take off. I think we actually have a question, Dr. Chung.
Okay, so the question we have is, the previous grading of 1 to 9 had 5 as the average standard. Is C the new equivalent? So C in this case is competent, which we defined as observing a certain behavior for the area being assessed as at least 80% of the time. So yes, we are considering C to be what we consider competent and what we consider to be acceptable for passing. So thank you for that question.
Another one of our frequently asked questions is, what if a student is not ready to provide direct patient care or doesn't show up ready to work? In that case, you have the option as the preceptor to send this student home and ask them to come back at, arrange another convenient time. They would have to make up the time. However, it is well within your right that if the student is tired or sleepy or just doesn't look ready to work and provide and engage with patients, it is definitely within your right to send the student home, and then also make a phone call to me, the manager of clinical education programs, to alert me to the situation so that we can also inquire back on campus. Another question is, what if the student asks to switch days? That, again, is up to you. The switching of the days, if they want to make a permanent switch, which please keep in mind the day that they are attending your site, they have chosen that day based on days that you have given us. And so they've chosen that day. If they want to make a permanent switch and you are okay with that, that is fine. But some paperwork does need to be done, and a phone call or an email with the email to the student as well as an email to me would be in line, so that I'm made aware and I know what day and time they are attending your site. And the last question that we have heard from is, what if my office will be closed on one of the clerkship days? If your office is going to be closed because of a holiday or a vacation, that is absolutely fine. We would ask if you are able to do a makeup with the student on another mutually convenient time for their schedule as well as yours. We would ask that be made. Otherwise, we can make arrangements on campus for another type of maybe a vision screening or something else that can make up for the lost time on their clerkship day.
Okay, we have a couple of other questions, so let me try to answer that in the last couple of minutes that we have here. One question is, are students required to stay until patient care is all completed at the site? The students are assigned to attend for a 4-hour session. So some of the students are there in the morning, 8 to 12, and some of the students are there from 1 to 5. We do want the students to stay at the minimum, the time that they're assigned. However, if you require them to stay longer, just check to see if the students have any other assignments. If they're there in the morning, it's possible the students need to make their way back for a class at 1 o'clock. And also in the afternoon, it is possible they may have to return to campus for an event. But in the case where they are not required to be anywhere, it is up to you to ask them to stay. Again, students cannot leave the session until the preceptor says it's okay to leave. The second question we have here is, are students supposed to keep a patient log on a weekly basis? And should I ask the student to show me the list? Some students keep a log that I see, some don't. And when asked, they state that they memorize the names and tasks performed. So I'll turn that question over to Kelly.
Students are supposed to log every patient. They're not supposed to log any personal information as far as a name. They're only supposed to they should have some type of little workbook that they should be writing in that would be their age range, what they're seeing the patient for, and all of those should be logged on a daily basis. We encourage students to log daily. Sometimes it is not done daily, sometimes it's done weekly, but yes, we do encourage them to keep some form of pen and paper with them at the site so that they are able to log their patients daily.
Great. Well, I don't see any more questions. I just want to say thank you, everyone, for joining us this morning to listen to the orientation for the Clerkship Program. I just want to close by again saying thank you for all that you do in the clinical education of our students here at Western University College of Optometry.
Thank you.